Welcome, welcome to my podcast. Today I'm going to talk about another case I read, and it has some common differential that I thought to bring to your attention. So after we introduce ourselves, as always, we agreed, double-check the patient name, date of birth. I'll ask the patient, how can I help you today? And the patient, who is in his mid-40, and he worked in a restaurant, just noticed that that in his face is developing multiple papules in the face and has been presented for some time. However, they are gradually multiplying, and the skin has been noticed to feel tight along. Even when he uses his mouth or smile, it doesn't feel right, it just feels tightened. And he noticed that along the work, his fingers start to tighten as well and stiffen. And he's just being concerned what's going on, and he came to the GP practice. He will ask the patient, do you have any thoughts what might be the reason for what might be the reason for this recent changes? The patient might say no. They will ask if they have any medical condition, if they have family history of some illness, and if they are taking any medication for some time, for whatever reason, just to explore what might be the issue underlying. When you have a look on the patient, you'll see there's numerous 1 to 3 millimeter waxy skin color and papules distributed in the body, including the face, neck, hands, the torso, and the thighs. And if you examine the joint, you notice that it's kind of restricted and it's reduced. However, there is no history of rhinoid or dysphagia. The patient tell you, I can't swallow, and I don't feel any coldness or spasm in my fingers. You'll ask the patient that might do some investigation just to rule out certain things, and you will start to think about certain differential in order to come up with something for the patient. So from this concept, we will think about systemic sclerosis. And we know systemic sclerosis is characterized mostly by skin thickening or hardening that starts in the fingers, hands, face. Papules is not usually seen in systemic sclerosis. I remember in my practice back home, I have seen only once across the years, and when you examine the patient hand, you wouldn't feel it's cold, or in order just to rule out if there's rhinoid phenomena, so the hand doesn't feel cold. And in certain situations it can feel the finger tighten as well. The other differential you will think of is, so I mentioned the systemic sclerosis, and there's also scleroderma, which is mostly manifested by calcinosis, telangiectasia, which can be seen around the finger. As we know, it's like matte papules, and of course they will feel cold. The patient will tell you, I'm having coldness in my finger, and sometimes they become hot, so that's in line with rhinoid phenomena. Then the condition you need to think of, myxedema, which associated with severe all over non-pitting edema, and the patient will have manifestation of hypothyroidism. And another condition you need to think of, and we used to see back home a lot of cases with this condition, and they have darkening, and I will tell you mostly in my back, but that's localized. But here I'm talking about generalized, which is called generalized amyloidosis. And in generalized amyloidosis, you'll notice that there is skin thickening and stiffening as well. So hence, I just mentioned the differential and asked the patient that I'm going to send you for certain blood investigation. So presumably the blood came back, And you notice that full blood count, liver function test, thyroid function test, inflammatory marker, all of them are normal. He was sent for electrophoresis, and electrophoresis shows that IgG, lambda mononuclear gammopathy is positive, and you will arrange for skin biopsy as well. And this shown fibroblast proliferation with increased mucin collagen deposition. So this is coinciding with something called scleromyxedema, which is a generalized form of lichen myxedema, a rare primary cutaneous mucinosis that affects middle age with no sex predilection. And the etiology is unknown. However, plasma cell has been contested as an underlying pathology. In most of those cases, the skin is really shiny, indurated, waxy, it's stiff, and kind of progressive. And it has been advocated that the first line of treatment is IgG, IV therapy. And if it doesn't work, second line is being advocated systemic steroid with immunomodulatory treatment. So what I'm trying to say here, usually the picture of the patient, when you see the patient who's presenting with those manifestation, usually when you see their face, you will feel that kind of stiffness, shyness of the skin, and you will see those generalized papules, which also can, of course, bring sometimes other condition, which is genetic, where you see multiple papules all over the body, but that's not the case, because that's another genetic condition, and it's mostly soft, and they are pliable and not stiff at all. I'm just bringing this because the condition is mostly clinically diagnosed. So like in this one, the most common differential that you put in mind, as I mentioned, is scleroderma, systemic sclerosis, amyloidosis, also myxedema, and this rare condition, which is scleromyxedema. So I hope by this I brought to your attention one of the differentiation can be considered whenever patient present with symptom aligning with generalized thickening and feeling restrictive of the skin. Let me know in the comment if you come across something like this in your practice, and if you find this case challenging and interesting. And I see you on another podcast. Thank you.